mind, the top 3 ingredients of successful scaling up are 1, early and appropriate stakeholder involvement in the process, 2, attention to both the horizontal and vertical aspects of scaling up. In other words, horizontal meaning expansion to new areas and new populations, and vertical meaning institutionalizing the innovation in existing frameworks, budgets, line items, work plans, etc. And the third, and possibly the most important one, is for a successful scale-up, one needs to have a resource team, a dedicated group of individuals who are in the interest of supporting the scaling up of whatever innovation it may be.
The first one is a successful and well-executed pilot. The second one is commodity supply. The third one is training and supervision, support supervision.
Working together with partnership is really important, but actually compromise from decision makers makes a difference.
With a strong national coordination and an integration in national channel from the beginning.
The pilot was supported by FHI, but it was working with other stakeholders like the AFIA Plus projects that were in the northeastern province of Kenya, and this is the site where the pilot took place. And it is from there now that it has now expanded its approach into scaling up into other areas outside these pilot sites. The biggest challenge facing this was actually presence of the right commodity for provision. But then when this was addressed, then the scaling up approach took root, and happy to say that it has gone beyond the pilot site areas as we are speaking.
In such a short span of time, it was a great learning experience. Results were quite positive, and stakeholders were quite involved in decision making, and they took it, and community involvement was very, very high. This was a great learning experience which will help us in scaling up this activity.
And whatever you do for family planning, think about the men to be and the women to be, adolescents.
From the time of the pilot to scaling up, the environment had changed in the situation that we were scaling up. The political, the bureaucratic, as well as in many instances service delivery providers had also changed. So that was one of the biggest challenges that we faced.
Monitoring and evaluation that are necessary during scale-up can differ in several key ways from that which was relevant in the pilot. For example, during pilot research or in early implementation phases, one needs to have evidence of the effectiveness of the innovation, and one also needs to understand how it can be implemented. Now, some of that research input is less necessary during the scaling up phase. However, other aspects don't go away. For example, one needs to continuously monitor whether the innovation during its scale up is having the intended impacts that it had during the pilot.